Hi, in this course you will learn all about Lyme disease from diagnosis to treatment and prevention, including several clinical and laboratory aspects related to this tick-related bacterial illness. In case you did not know, Lyme disease gets its name from Lyme, a town in the state of Connecticut. The first cases of Lyme disease were reported in Lyme, Connecticut back in 1975. All of a sudden, quite a few children presenting with symptoms of arthritis had reported to the doctor's offices. At first they thought it was juvenile rheumatoid arthritis. Then what was noticed was that all the children were or had been in a wooded area, and this happened during the summer months. Then only did the medical staff noted the infectious nature of the illness and suspected the transmission through a tick vector. And they started wondering if it was occurring through the skin. Then they found out that a tick vector indeed was the carrier of the disease. One important note is that it's only by accident that humans get infected with Lyme disease. That's because the natural host for the bacteria is the mouse. First of all, the main question is why Lyme disease? Well, in the next set of slides, I will go over some key points highlighting the significance and importance of this tick-borne vector illness caused by a spirochete. Next, I will show some clinical manifestations that are commonly known for Lyme disease and some data related to epidemiology of this illness. Further on, since Lyme disease is a tick-transmitted infection caused by a bacteria, I will describe the tick and the tick's life cycle and how the bacteria is transmitted from the tick to humans, and I'll also provide a description of the bacteria that causes Lyme disease. Furthermore, I'll mention the differences between tick and bacteria that have impact on the disease. Finally, after understanding the clinical diagnostics, I will go over the laboratory diagnosis of Lyme disease. And finally, I'll highlight some aspects of treatment and prevention for this tick-borne illness. So, why Lyme disease? Well, because according to the CDC, that is the Centers for Disease Control and Prevention, Lyme disease is now the fastest growing tick-borne, vector-borne illness in the US. In 2015, the CDC estimated about 30,000 US residents are infected with Lyme disease each year. But this government agency notes that underreporting could put the actual count up to 300,000 cases. Also, the number of cases of Lyme disease has increased 25 times since the beginning of a nationwide surveillance that started back in 1982. Furthermore, Lyme disease is also the most common tick-borne illness, while West Nile virus infection is the most common mosquito-borne infection in the country. Now, in terms of morbidity, or the quality of being sick or unhealthy, the ability of the bacterial infection to cause a disease, in this case in Lyme disease, is high. That is because of the arthritis, Bell's palsy, and other common complications of the disease. Furthermore, although antibiotic treatment works, depending on which stage the patient comes for treatment, in some cases the antibiotic therapy may not work to alleviate the ailments caused by the disease. For all these reasons mentioned above, and of course due to the fact that I have done my graduate research work on Lyme disease, I have decided to create this course on this unique tick-borne illness.